Now, the take-home message is that CBD shows promise in treating certain cardiovascular conditions, particularly our inflammatory diseases such as myocarditis and pericarditis. However, while we see encouraging signs that CBD's anti-inflammatory and antioxidant effects could benefit patients, current evidence is limited to suggest practice change due to limited trials, ongoing safety and regulatory concerns, and issues with variable dosing. And I wanted to share a few key thoughts from our review, which will appear in Mayo Clinic Proceedings, Cannabidiol or CBD in Cardiovascular Disease, a review of current evidence and future directions. Now, CBD is a non-psychoactive compound and has numerous effects on the cardiovascular system through many different channels, including TRPV1 channels. And through these effects, is able to enact anti-inflammatory, antioxidant, and vasodilatory effects, which could prove beneficial in numerous cardiovascular conditions. Now, one of the areas where CBD's potential is perhaps most evident is in the world of pericarditis, or more specifically, recurrent pericarditis. Now, this can be a debilitating condition for patients, especially those who experience continuous chest pain and do not respond or cannot tolerate current treatments, which include NSAIDs, colchicine, steroids, and interleukin-1 inhibitors. In fact, in a recent phase 2 trial, which included 27 patients with recurrent pericarditis who were given a purified form of CBD, patients experienced significant and rapid pain relief. Our review suggests that CBD could form as a novel, non-immunosuppressive therapy for these patients. And given these encouraging results, a larger phase 3 clinical trial is currently undergoing to definitively test CBD in recurrent pericarditis. Similarly, CBD has shown promise in myocarditis. In preclinical studies using models of autoimmune myocarditis, CBD demonstrated the ability to reduce cardiac inflammation and fibrosis. And in another phase 2 clinical trial, which Mayo Clinic also participated in, patients with acute myocarditis were given pharmaceutical-grade CBD over the course of 12 weeks and demonstrated improvement in cardiac MR markers of inflammation. Now, importantly, these trials were limited by small sample size, and further robust trials are required to establish their safety and efficacy in this population. We also discussed CBD's potential benefit in ischemia reperfusion injury. In preclinical studies, when CBD was administered at the time of an induced heart attack, CBD was found to reduce overall infarct size by up to 66% in some studies. However, this has only been demonstrated in animal studies, and clinical studies are still pending. We discussed whether CBD's anti-inflammatory and antifibrotic properties may provide some benefit in heart failure, and we also look into CBD in hypertension, where administering CBD was found to have modest reductions in 24-hour blood pressure. However, whether this translates to clinical, meaningful benefit is still to be elucidated. Now, here at Mayo Clinic, we care for a large referral population of patients with refractory pericarditis despite advanced therapy, and face issues with tolerability and a long-term strategy. And it's because of this that Mayo Clinic has been at the forefront of some of this research in establishing CBD as a potential non-immunosuppressive option for these patients. Professor Chadi Ayub in Mayo Clinic in Arizona and Dr. Alan Lewis in Mayo Clinic in Rochester, both of which have senior authors on this paper, have been instrumental in some of the aforementioned clinical trials, including the Maverick trial for pericarditis and the Archer trial for myocarditis. Over the next few months, the focus will continue on pharmaceutical-grade CBD research, with a particular rigorous focus on clinical endpoints, safety, tolerability, and potential drug-drug side effects. Now, it's important to highlight some of the limitations and cautions of CBD in cardiovascular disease. First, the data still remains quite heterogeneous and limited in human populations, with substantial variation in dosing, formulation, and route of administration in these studies. Its clinical use cannot be recommended before large, robust clinical trials can demonstrate safety and efficacy, particularly in cardiovascular populations. Second, CBD inhibits cytochrome P450 enzymes, which does raise concern for potential drug-drug interactions with common cardiovascular medications, such as warfarin and amiodarone. Thirdly, consumer products also pose an additional risk, with wide variations in purity and formulation, and an increased risk of self-prescribing. Looking ahead, future directions include a move from biological plausibility to practice-changing, reproducible clinical evidence, using standardized formulations and hard clinical endpoints. In pericarditis, the current Maverick 2 and Maverick 3 trials are undergoing to establish whether CBD can induce remission and reduce relapse rate for patients with refractory pericarditis. The Archer trial is currently undergoing for myocarditis to establish its safety and efficacy in this population. Work should also be done to address practical implications, including standardized protocols and formulations for clinical trials in patients, as well as regulatory concerns with future introduction. In closing, on behalf of the authors, I'd like to thank you for watching this video. and for Mayo Clinic Proceedings for the opportunity to share our work, and we hope this review provides a useful resource to the cardiovascular community.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.